Hi everyone, my name is Lais and welcome to my general question video presentation, which I will talk about schizophrenia. What are the main symptoms? Schizo means split, and phrenia in this case refers to the mind. Even though schizophrenia can be interpreted to mean splitting of the mind, it doesn't refer to a split personality, like some media sources might portray. But schizophrenia describes a fragmented pattern of thinking. So what is it? Schizophrenia is a chronic mental disorder that affects how a person thinks, feels, and behaves. The symptoms often develop gradually, and the diagnosis is generally made in the late teens to the early 20s for men and the mid to late 20s for women. Symptoms. Schizophrenia can also be considered a syndrome, meaning there are all sorts of symptoms that might be associated with it, and different patients might experience different symptoms. Although the symptoms can be broadly categorized into three major areas: positive, negative, and cognitive symptoms. Positive symptoms. The word positive does not mean the symptoms are helpful, but positive in a sense of having something added to the experience. Positive symptoms are psychotic symptoms, so exaggerated ideas or actions that indicates challenges in discerning what is real and what is not. The positive symptoms are delusions, hallucinations, disorganized speech, disorganized behavior, and catatonic behavior. Delusions are false beliefs that are not based in reality, and the patient might feel very strongly about, so much so that they won't change their mind even if you give them evidence against it. There are all sorts of different delusions, like for example, a delusion of control, where somebody thinks that some outside force or person or thing is controlling their actions. It can also be delusion of reference, when somebody might think that insignificant remarks are directed at them, like a newscaster is speaking directly through the TV. Hallucinations are the second type of positive symptoms, and it can be any kind of sensations that is not actually there, including visual, but also including auditory sensations, like hearing voices or commands. A third type is disorganized speech. An example would be something called word salad, which seems like just random jumbling of words or phrases, like pencil, chicken, coffee, tent, blue. Disorganized behavior, on the other hand, could be like if they exhibit bizarre or silly behavior that's out of context and does not seem to have much of a purpose, like for example wearing multiple layers of jackets in a hot summer day. Also, sometimes the behavior is described as catatonic behavior, which has to do with their movements, posture, and responsiveness. So they might be super resistant to moving or be in an unresponsive stupor. Negative symptoms are things missing from normal experience, like a loss of interest in normal activities or difficulties with social interactions. It's a removal from normal processes, a decrease in the emotions they can express, or a loss of interest in things. One type of negative symptom is called flat affect, where they don't respond with an emotion or reaction that would seem appropriate. Like if they see something very unexpected, like a zebra chilling in their living room, they might simply sit and watch as if nothing was happening. Another type is alogia, or poverty of speech, which is a lack of content in speech. So if somebody asks them, "Do you have any children?" they might respond with "yes," instead of "yeah, one boy and two girls." Another type of negative symptom is avolition, which is a decrease in motivation to complete certain goals. So someone might stay at home for a long period of time without trying to reach out to friends or find work. Cognitive symptoms include things like difficulty focusing, not being able to remember things, learn new things, and understand others easily. These symptoms are more subtle and more difficult to notice and might only be detected if they have really specific tests performed. People with schizophrenia seem to cycle through three phases, typically in order. During the prodromal phase, patients might become withdrawn and spend most of their time alone, and often they seem similar to other mental disorders like depression or anxiety. During the active phase, patients experience more severe symptoms like delusions, hallucinations, disorganized speech, disorganized behavior, or catatonic behavior. Following an active phase, patients often enter into a residual phase, where they might exhibit cognitive symptoms, like not being able to concentrate or becoming withdrawn again, as with the prodromal phase. Treating schizophrenia can be very tricky, and antipsychotic medications are often used, but it's super important to combine the treatment with several clinicians and health professionals. These are my references, and thank you so much for watching.